Hi, I'm Dr. Graeme Reed. I'm the Medical Director at the Family Doctor and also of Nani Aesthetic Medicine. And today we're going to be demonstrating a combined procedure. It's combined Max G, which is an intense pulse light procedure, along with 1540 infrared laser treatment. This combined procedure is ideal for people who have either pigmented lesions on the face or vascular lesions on the face in combination with some surface problems, or they just want to have some kind of surface treatment for tightening and fine lines and things like that. So what we do is we initially we treat with the Max G, and then after that we follow it with the 1540. Our office manager and nurse, Marie, is going to be our volunteer today, and she is a skin type 4, but we also use the melanin index, the skin tell device here, to find out what her melanin index is in the area that we're going to be treating. So we put a little bit of the Lux lotion, which helps to transmit the light, and then we press the button, wait for it to be ready here, and okay, that's 1, and we do it a second time, 2, and we do it a third time, 3. So that should, now do I have to press this?
Yes.
22 is correct value. We established that Marie has a melanin index of 22, and that corresponds with what we've calculated anyway for her. So we've entered that, and for her small facial blood vessel problem, the little telengiectasias that she has around her nose, we've selected a pulse width of 15 milliseconds. And for that we want to have a power of about 32 joules per square centimeter. So we've set all that up. We're wearing our eye protection because this is intense pulse light. And we're going to use the Max G. And we're going to put on some Lux lotion first. This is only going to take a very few pulses probably, because she's just got a little bit of telengiectasia around the area here, right there, and also on this side. So we'll do that initially, but we will do a test spot first to make sure that we don't get anything bad happening. Turn the machine on. There we go. Alright, so I'm going to do a test spot right about here. Is that okay? Mm-hmm. Tell me if you have any discomfort. You flinched, but it felt okay. Mm-hmm. And Marie has been pre-medicated with a topical anesthesia, 30 minutes, and now feels quite numb. Mm-hmm. But we always do a test spot, and we want to see if there's too much of a skin reaction. And we've got a little redness, but it's okay. It looks perfectly fine, just what we want. Okay, so we're going to do the treatment itself. I'm going to come in right in here. We've got to do some overlapping here so that it's properly treated. Okay? I think that's about it for that. So typically this feels like being flicked with a rubber band. Is that what it feels like? Mm-hmm. Okay, so I think that's about it for the telangiectasias. So, a little bit right there. How about the other side of your face? This side looks okay. Okay, so we'll treat that side as well. Just right around here. Perfect. Okay, back in business. Here. Okay. Very good. Is that okay?
Yeah.
Not too uncomfortable? Alright, so that's, you can see that Marie is using this icy roller from time to time. We keep that in the freezer. It's filled with a coolant material that freezes, and then it does provide some comfort. You feel like a little bit of a sunburn after you've had these types of treatments. But that feeling goes away, and you can see that there's an area of erythema here and here as well. But that clears up reasonably rapidly. You do have to watch out, of course, for exposure to the sun, because that can cause hyperpigmentation if you're not very careful. So we always counsel people to stay out of the sun. If you can't avoid sun exposure, then use SPF 50 and put more on frequently, every few hours or so that you're not, so that you can reduce that risk of hyperpigmentation. Okie dokie, so now we're up to the 1540 part of the procedure, and for this we're going to use a 15 millisecond pulse width, and we're going to use 28 millijoules per square centimeter of energy. And we're using the 1540 XF tip. We don't need Lux lotion for this because it's not in the visible light spectrum, it's infrared. And we're just going to methodically go over the entire face. We'll start off on the left cheek. We'll do all of this area underneath the eyes to the nose, down here. We'll do across the nose and the upper and lower areas there, and then we'll do the right, and then we'll do the forehead. Fairly simple. Okay, maybe you can just turn your head a little bit that way. Perfect. And we're going to start, of course, with a test spot. We'll go right up here. And we're using our special eye protection for this frequency of light. Do our test spot. How was that? So we're ready to start, and I find it best just to do things in a very methodical and orderly fashion. We'll start here. We do want to have about 50% overlap between of each of the applications. And that's what we're doing here. And I've set this to automatically fire approximately once every second, which gives me time to move the device into the desired space before it fires. You can see that there's some erythema where I've been, and this is perfectly normal. This also will resolve reasonably quickly. Let me go over here. Okay. Because of the way this works, it's actually sending up numerous columns of infrared light into the skin, and there's spaces between those columns. So if we can overlap enough, we can increase the percentage of skin that actually gets treated. Now we don't want 100% of the skin being exposed to this infrared light. We want somewhere between 20 and 30%. Because then what you have is the surrounding skin starts its healing process, and we do the same type of methodical approach. Start here. The tip of this device does have a special lens on it which contains coolant which recirculates through the machine and provides cooling to the skin as we're doing the treatment, which is very helpful. Just pull this back a little. One of the advantages, of course, of having the cool roller is that the patient can determine how much cooling she needs and apply it as needed. Alrighty, and that's that. Certainly for patients who are skin type 4 or above, who may tend to be subject to hyperpigmentation more than others, often we prescribe 4% hydroquinone cream that they can apply, which will interfere with melanocyte production of pigment and so on, that will reduce that possibility. So we'll give Marie a prescription for 4% hydroquinone, which she can apply herself. Now that we've completed both the intense pulse light Max G treatment as well as the 1540 infrared laser treatment, her face is a little erythematous, but that will pass very quickly, within an hour or so, and she feels like she's got a bit of sunburn, so it's kind of hot, and she's been using the cooling roller, which helps. Also, we typically give ice packs to take home, and then of course SPF 50 sunscreen, and stay out of the sun as much as possible after the treatment. So we at Nani Aesthetic Medicine provide this treatment. We provide a number of other treatments, including laser hair removal, other pigmentation problems we can deal with. We provide Botox injections, fillers injections. We also have the Sculpture fat reduction system here. So any of these aesthetic needs that you may be interested in, give us a call, 674-4300, and we'd be happy to give you a free consultation and just see what it is that we can help you with your aesthetic needs.